Welcome to the deep dive. Dealing with the Social Security disability claim process, it can just feel like a maze, can't it? Especially when you're already dealing with a health condition. But there's this one particular point, a really critical step that can often be the deciding factor. It's called the consultative examination. So today what we want to do is really help you get a handle on this, our mission. Move you from feeling confused, maybe a little anxious, to feeling confident. We'll break down what this exam is, why the SSA orders it, and crucially, how you can prepare effectively. We've dug into a really comprehensive guide on this and pulled out the most powerful strategies just for you.
Yeah, and that's exactly why we're diving deep today. Because honestly, understanding this exam and preparing the right way, it can literally be the difference between getting your benefits approved or denied. It really is about maximizing your chances, giving the SSA the clearest, most objective picture of what's going on with you.
Okay, so let's start there. This term, consultative examination, or CE, it sounds pretty formal. How is it actually different from just, going to see your own doctor? What's the SSA really trying to achieve here?
That's a really common question, and it's a key distinction. So a CE is a medical evaluation,
Right.
but it's ordered by the SSA. And it's done by an independent medical professional, usually someone they contract with. So, importantly, not your regular treating doctor.
Ah, okay, independent.
Exactly. And the main goal isn't treatment. It's about gathering more objective medical evidence, specifically about your current functional limitations.
Yeah.
Basically, how your condition affects what you can actually do day to day, especially concerning work. It's purely for the disability determination.
Right, strictly evaluation, not care. That makes sense. So where does this fit in the whole SSD claim timeline? When does this exam usually happen?
Well, typically the SSA looks at your initial application and all the medical records you sent in. If they feel something's missing or not current enough or maybe not specific enough about your functioning, that's when they'll likely order a CE. So you'll get scheduled, you go attend the exam, the doctor writes up a report and sends it back to the SSA, and then the SSA disability examiner looks at that report along with everything else in your file to make the final decision.
Yeah.
So it's often a pretty central piece of the puzzle.
Okay. Now, this is probably what a lot of folks wonder. Why do they even need this? Don't they have all my doctor's notes already? What kind of gaps are they usually trying to fill?
Yeah, and understanding the why behind your specific CE can really help you prepare strategically. There are a few main reasons. The biggest one, happens in about 45% of cases, is simply insufficient medical evidence. Maybe your records don't really spell out your current functional limits clearly.
Like how far you can walk or lift things.
Exactly. Or maybe there are gaps in your treatment history, or your own doctor just hasn't assessed those specific things in the way the SSA needs.
Okay.
Then, about 25% of the time, it's because your medical evidence is outdated. If the latest info they have is more than, say, 90 days old, they need something current.
Makes sense. Conditions change.
Right. Another 15% or so is due to conflicting medical opinions in your file. So they bring in an independent view to help sort that out.
I see.
Maybe 10% is because they need specific testing done, like a particular psychological test or maybe a specialized physical exam that's not in your records. And the last 5% are just various other administrative requirements. So, yeah, knowing why they ordered yours can really help you focus on what information they're looking for.
Okay, that breakdown is really helpful. So we know what it is, why it happens. Let's get into the practical stuff. How can you really prepare for this? What's the absolute first step?
Right. The first and honestly foundational strategy is to gather and organize your own medical documentation. Don't just assume the SSA has everything or that it's all easy for them to find.
So, make your own file.
Pretty much. Compile all your relevant medical records, test results, maybe even create a simple timeline of your treatment, diagnosis dates, hospital stays, therapies, changes in your condition. Having your own copies means you know it's there, and you can even bring key documents if needed.
And what about medications? That seems important too.
Hugely important. Make a detailed list of all current medications. Include the dosage, who prescribed it, what condition it's treating, and crucially, list any side effects you experience that impact your daily life or ability to function. Drowsiness, nausea, brain fog. That's all relevant functional information.
That's a great point about side effects. Okay, so you've got your paperwork sorted. What's the next strategy for getting ready for the actual exam day?
Strategy 2 is to understand the examination format and what to expect. Knowledge reduces anxiety, right?
Definitely.
So these CEs usually last about 30 to 60 minutes, not super long. They'll typically involve the doctor reviewing your medical history with you, doing a physical exam relevant to your condition, and then some kind of functional assessment.
Functional assessment, like asking you to do things.
Yeah, they might assess things like how long you can comfortably sit, stand, walk, maybe lift or carry light objects. Basic work-related physical things. If it's a mental health CE, expect things like cognitive screening, memory tests, questions about your mood and daily functioning, psychological assessments. The key is to be ready to give honest, detailed answers about your limitations when they ask.
Okay, honest and detailed. That sounds like it connects to the next point. How do you best communicate those limitations, especially if you struggle to find the words on the spot?
Absolutely. That leads straight into strategy 3, which is incredibly powerful. Document your daily limitations and symptoms before the exam.
Like keeping a journal.
Exactly. Keep a diary for, say, at least 2 weeks leading up to the appointment. Track your pain levels, fatigue, any cognitive issues, dizziness, whatever your symptoms are. But don't just list symptoms. Note how these specifically affect your daily tasks: cooking, cleaning, bathing, shopping, concentrating on a task.
The how.
Yes. And make sure you capture both your good days and bad days. This shows the variability, which is often a key feature of chronic conditions. And use specific examples. Don't just say, my back hurts when I walk. Say something like, after walking about 1 block, I get sharp pain in my lower back, maybe a 7 out of 10, and I have to stop and rest on a bench for maybe 10-15 minutes before I can go on.
Wow. Yeah. That paints a much clearer picture than just trouble walking.
It really does. That level of detail gives the examiner concrete evidence they can put in their report.
That's a fantastic tip. Okay, so you've got your diary, you've got your examples. What about the direct questions the examiner will ask? How do you prepare for those?
Right. Strategy 4 is prepare for common examination questions. You can anticipate a lot of what they'll likely ask. Things like, tell me how your condition affects your day-to-day life. Or, walk me through a typical day for you from morning till night. Also, what activities have you had to stop doing or cut back on because of your condition? How far can you walk before you need to stop? How long can you sit or stand before you get uncomfortable?
And the medication question again, probably.
Definitely. What medicines are you taking? What side effects do they cause? Think through your answers beforehand. And again, the key is be clear, be specific, and be honest. Don't downplay things, but don't exaggerate either. Just describe your reality as accurately as you can.
Makes sense. Accuracy and honesty. Now, shifting gears a bit, are there practical things, like just getting to the appointment, that people need to think about?
Oh, absolutely. Strategy 5 is all about planning your transportation and arrival. Seems simple, but it's important. Arrange reliable transport well in advance. Plan to get there maybe 15, even 30 minutes early. Rushing adds stress you don't need.
Good point.
And think about this. If your disability actually affects your ability to drive or makes using public transport really difficult, that itself is relevant information about your limitation. You can usually bring someone with you for support, like a friend or family member, but typically they'll have to wait in the waiting area. They usually aren't allowed in the exam room itself.
Okay.
And here's a key tip. If the journey to the exam, the walking, the sitting in the car, whatever actually makes your symptoms worse, tell the physician that. It's another piece of real-world evidence about how your condition impacts you.
That's smart. Capturing the impact beyond just the exam room. Okay, what about how you actually show up? Dress code, things to bring.
Yep. Strategy 6, dress appropriately and arrive prepared. Wear something comfortable you can move in easily, because they might ask you to do some range of motion tests or simple movements. But, keep it appropriate for a medical office setting. Clean and neat is fine. And this is crucial. If you normally use any assistive devices, a cane, a walker, braces, special shoes, anything, definitely bring them and use them just like you normally would. Don't leave them at home trying to seem more capable.
Right. Be authentic to your daily reality.
Exactly. And have all your necessary stuff organized and ready. Your ID, maybe insurance info if they asked for it, and definitely that list of medications you prepared.
Got it. Okay, this leads us to what you mentioned earlier sounds like maybe the most important strategy of all.
Yeah, strategy 7 really underpins everything. Maintain honesty and consistency throughout. This is, without a doubt, the most crucial piece of advice. Be completely honest about your symptoms, your pain levels, what you can and can't do. And consistency is key. What you tell the examiner should match up with your behavior during the exam and also with what's in your medical records.
So don't say you have excruciating pain, but then bounce around easily.
Exactly. Examiners are trained observers. They'll notice inconsistencies. Don't try to put on a show of being disabled, but also don't try to hide your pain or limitations out of pride or stoicism. Just be natural. And if you happen to be having a particularly good day or a really bad day, tell the examiner that. Give them context. Explain that your condition fluctuates and what a more typical day is like for you.
That context seems really important. Okay, so let's say you've done all the prep, you're there, you're being honest and consistent. What actually happens during the exam? What's the flow?
Right, once you're in the room, it usually starts with that detailed medical history review we talked about. They'll ask about your symptoms, treatments, medications, daily activities. Then comes the physical exam part. This will vary a lot depending on your condition, but it could include things like checking your vital signs, testing your range of motion in affected joints, checking muscle strength, maybe some basic neurological tests like reflexes or sensation. For mental health CEs, as I mentioned, it'll be more focused on cognitive tests, memory, concentration, mood assessment, talking through your symptoms and how they affect you. And then there's the functional assessment part. They'll observe how you move, how you walk, get up from a chair, sit down. They might ask you to try standing for a bit, or walking a certain distance, maybe lifting a light object, or doing something with your hands to check fine motor skills. Throughout all this, remember, the examiner is observing not just your answers, but your behavior, your appearance, how you move, how you respond.
It sounds like you really need to be mindful of, well, everything. This brings up an important point. What are some common mistakes people make during the exam that could actually hurt their claim? Maybe things they don't even realize are mistakes.
That's a really insightful question. One big one we already touched on is minimizing symptoms. People sometimes try to tough it out or feel embarrassed to admit how much they struggle. But the examiner needs to know your real limitations.
So trying to be brave can backfire.
It really can, yes. Another major pitfall is that inconsistency, claiming severe knee pain, but then popping right up from the chair without any difficulty. Or saying you have shortness of breath, but showing no signs during the exam. Be natural. Let your limitations show organically.
Okay, be genuine. What else?
Failing to bring necessary documents like your medication list or just being generally unprepared for the questions can make things difficult and might suggest you're not fully engaged. Also, missing the appointment or being significantly late without a very good reason and without contacting the SSA can be seen as non-compliance, which is a big problem.
Right.
And lastly, trying to bring other people into the actual exam room when they're not authorized or trying to argue with or coach the physician on what they should write, that usually doesn't go over well.
Yeah, I can imagine. Okay, so the exam's finished, you walk out the door. What happens then? What's the process after you leave?
Okay, so after you leave, the examining physician takes all their notes, their observations, the test results, and compiles a detailed report for the SSA. This report will outline their clinical findings, their assessment of your functional limitations, what they think you can do in terms of sitting, standing, lifting, etc., and their medical opinion based on the exam. But here's the crucial thing to remember. The CE physician does not make the final disability decision.
Okay, so their report is just evidence.
Exactly. It's a very important piece of evidence, but the ultimate decision is still made by the disability examiner back at the SSA. That examiner takes the CE report and looks at it alongside everything else your treating doctor's records, other medical evidence, your work history, your statements. It's all considered together.
Right. It's part of the whole picture, not the only picture. That reinforces why having all your other documentation in order is so vital, too.
Precisely.
So what happens if someone gets a bad feeling after the exam? Or maybe later they hear something about the report and they really disagree with the findings. What can they do?
That's a very valid concern. If you believe the report is inaccurate or doesn't fully capture your limitations, you do have options. You can submit additional medical evidence to the SSA to counter it, maybe get a detailed statement or a functional capacity evaluation from your own treating doctor.
Okay, so provide more evidence.
Yes, and a few other common questions people have. If you absolutely have to miss an appointment, call the SSA immediately to explain why and reschedule. Just not showing up can lead to denial.
Good to know.
We mentioned support people usually wait outside. In terms of getting the results, you don't get them directly from the CE doctor. They send the report to the SSA, usually within maybe 10 to 20 days, but the final decision on your claim will take longer. And importantly, the cost. The SSA pays for the consultative examination. You should not be charged anything for it.
Okay, that's good to know too. Wow, we've really covered a lot of ground here. This deep dive has definitely unpacked the CEH, clear just how critical this step is. And it really hammers home that preparation isn't just like, nice idea. It seems absolutely essential.
It truly is. Approaching the CE with confidence really comes down to being prepared, being honest, and understanding the process. Every bit of preparation, organizing records, thinking through examples, planning the logistics, it all helps build that complete, accurate picture for the SSA about how your condition genuinely limits your ability to work and function. It strengthens your entire case.
So, thinking about the listener now, beyond just acing this one specific exam, what's the bigger strategic takeaway here?
Well, here's something to really think about. We focused intensely on the consultative exam today, right? But remember, it's still just one piece of your overall disability claim puzzle. So the provocative thought is this. How does the CE fit into the bigger landscape of all your evidence? What other kinds of proof, what other documentation or statements could you gather beyond just this exam to paint the most complete, the most compelling, and the most undeniable picture of your disability for the SSA? Thinking about that whole tapestry, not just this one thread, that's where you can potentially find ways to significantly strengthen your claim overall.